Today's discussion is going to be on how to promote lymphatic health during and after cancer treatment. I'm Angela Wicker-Ramos. I'm a certified lymphedema therapist and oncology rehab physical therapist in Austin, Texas. I'm the owner of Cancer Rehab and Integrative Medicine and the co-founder of the Moving Beyond Cancer Collaborative, a nonprofit here in Austin, Texas. Our discussion today is going to be for anyone who has had their lymphatic system impacted by cancer treatment, and that's pretty much anyone who has had cancer treatment. So let's start about talking about what your lymphatic system is. It's a very underrepresented system in the body. We often don't know a whole lot about it until we're diagnosed with cancer. Your lymphatic system has two jobs. The first job is it's there to help circulate fluid through your body. Circulating fluid through your body is a natural, normal thing that brings fluid to your cells, gives your cells the nutrients they need. Your cells dump what they don't need back into the lymphatic system, and then that fluid moves out of the lymphatic system. Also, your lymphatic system's job is a part of your immune system too, where each lymph node is a filter that filters out toxins, helps you fight infection and fight disease as well. And your lymphatic system is important in producing white blood cells called lymphocytes as well. So this here is a picture of your lymphatic system, and you can see that there are so many vessels throughout the body and lymph nodes throughout the body. In this picture here, you can see groups of lymph nodes in the head and neck, groups of lymph nodes in the armpits, lymph nodes in the pelvic area, and several deep abdominal lymph nodes as well. You also have a few behind the knee. Now, the area where your lymph nodes live is the area or the region where lymphatic fluid moves. So in this diagram, since we're specifically talking about the impact of lymphatic injury on people who have had breast cancer treatment, we are speaking primarily about the lymph nodes in the armpit area here, as well as sometimes, in certain cases, lymph nodes in the sternum area here. These lymph nodes are in charge of draining fluid from the arm on that side, from the chest on that side, as well as the same area in the back, so around the shoulder blade area as well. So anytime we're talking about promoting lymphatic health, we're specifically speaking about this region right here, or the opposite side if that was the side where you had lymph nodes removed. The lymphatic system is an entire system, runs through the body, but groups of lymph nodes are in charge of certain regions. So please keep that in mind as we continue to discuss this topic. Groups of lymph nodes, as you can see, and as we mentioned a moment ago, you have groups of lymph nodes in the neck. Look how many you have. You have so many lymph nodes in the neck. You have inguinal lymph nodes, which are the lymph nodes in the pelvis. And then you have axillary lymph nodes. Those are the ones we're going to be discussing today. Those are the ones in the armpit. And there's about 30. Everyone has a slightly different number, but on average, about 30. Your lymphatic system has multiple structures. The important ones that we're going to be talking about today are the lymph nodes, which are the actual filters. They're pea-sized structures that filter out toxins and help produce white blood cells. Those lymph nodes are the nodes that are removed during cancer treatment. There's the lymphatic vessels. If we go back to this image here, the vessels are the highway system or the straw-like structures that move fluid to lymph nodes and away from lymph nodes. And then the thoracic duct. The thoracic duct is the largest highway system for your lymphatic system, and it runs up the abdomen. So all the fluid in the lower body moves up that highway system, that thoracic duct. The fluid in the arms moves up that area as well, and then it dumps into veins up in your neck. So the thoracic duct is one of the most important vessels in your lymphatic system, and that's going to come into play in a moment. This image here is an image of your skin. You can see the hairs on your skin. And as we go down the layers of your skin, you can see down here, right underneath the skin, right around, this is the fat that we have in our tissues. So if we work our way down, you can see that these are finger-like structures for your lymphatic vessels that run through and deeper into the fat and then deeper into your system. This image here, what we're looking at, what's in blue, are your veins up here by your collarbone. Remember a moment ago I said your lymphatic fluid moves up the abdominal area, it moves up and it dumps into the veins right up in here. So this is a closer image of that where these lymphatic vessels dump lymphatic fluid into the veins. So your lymphatic system is a one-way system, moving everything up the body and dumping it into the veins. Once it's there, it's now your blood moving through your body, filtered as your blood is filtered, and then urinated out. Right here is a very close-up of your lymphatic vessels. These vessels here, notice they have these valves, and fluid is moved up these vessels in the direction that we want fluid to go. How does that fluid move up? Not only do you have smooth muscle in the actual vessels themselves, but our large muscles throughout our body that surround these vessels help pump the fluid up. So our muscle pumping action, what happens when we move, is imperative for lymphatic flow. 3 easy ways to promote lymphatic health. First is deep breathing. In a moment, we're going to practice that. Why deep breathing is important? That thoracic duct, that large highway system that runs up the abdomen. By us taking deep belly breaths, we're stimulating or helping pump that large highway system that stimulates the entire lymphatic system. Staying well hydrated. It's imperative you stay well hydrated so lymphatic fluid can move with proper fluid intake. And then exercise. Remember that pumping action we were talking about, where those lymphatic vessels need all of your surrounding muscles to be pumping, contracting, and relaxing to move lymphatic fluid. So let's practice a deep diaphragmatic breath really quickly. So the gentleman in the picture, if you could do what he's doing, you're going to place your hand, one hand on the sternum and one hand on the belly. When you take a deep inhale in through your nose, you're going to think of expanding your belly out or making your belly larger by breathing in. So as you inhale, your belly expands. And as you exhale, you gently scoop your belly button in. Inhale, your belly expands, and exhale, your belly button scoops in towards your spine. That is milking your thoracic duct and helping stimulate your lymphatic system. You can do that 5 to 10 repetitions as long as you don't get too dizzy, many times per day, okay? So now knowing signs of lymphedema, if we look at this word lymphedema, lymph means lymphatic fluid and edema means swelling. So lymphedema is an abnormal swelling that can happen from injury after or during cancer treatment. Your lymphatic system can be injured in 2 ways. One way is the actual removal of lymph nodes, whether it's a sentinel lymph node biopsy where they're taking out several lymph nodes to check to make sure the cancer hasn't spread, or axillary lymph node dissection, where they are removing almost all of the lymph nodes in the axilla. Another way that your lymphatic system can be damaged by cancer treatment is damage to the lymphatic vessels, which primarily happens either during surgery through an incision, through actually being cut across lymphatic vessels, or in more cases, the injury is more profound with radiation treatment, where that entire region that your body is having radiation, the lymphatic vessels in that region in the front of the chest or even the side can scar down, create inflammation, and damage those vessels as well. What can happen when your lymphatic system is damaged? Sometimes your lymphatic system is able to adapt and there's no backup of fluid, meaning your lymphatic system is injured, but it's working well enough to move fluid out of that quadrant on the side of injury. However, sometimes what can happen is the lymphatic system is injured and it's no longer able to pick up and move that fluid out. So there's a congregation of fluid in that region. Signs of lymphedema include swelling, that's obvious, right? A feeling of heaviness or tightness in that quadrant or in that region on the side you've had your lymph nodes removed or you've had radiation treatment. Feelings of heaviness or tightness can sometimes be the precursor to swelling. So if you're experiencing either of these symptoms, you definitely need to reach out to the medical doctor on your team, whether it's your surgeon, your medical oncologist, or your radiation oncologist, to discuss. Let them know. Aching and discomfort. Aching and discomfort can happen for many reasons. It may not be lymphedema, but if it's something that you weren't experiencing previously and now you're experiencing, you absolutely need to let your medical doctor know. Do keep in mind that swelling after surgery or radiation treatment is completely normal. Swelling is a normal response to bring in cells to promote healing. However, your swelling that you're experiencing during cancer treatment, whether it's from surgery or radiation, should not last any longer than 3 to 6 months after your treatment is done. And also, that swelling should gradually be improving. You should be seeing improvements every single day, every single week. If that swelling resolves and then it comes back, or that swelling just doesn't get better, that's the time where you need to go to your medical oncologist or your medical doctor or your surgeon and let them know. That could mean that your lymphatic system is so injured that it's not able to move the fluid out the way it needs to, and that could be lymphedema. In these images here, there's our various stages of lymphedema. Right here, this is early stage lymphedema. We have advanced stage lymphedema down below. And then the image of the chest, I want you to notice how when this woman took off her bra, you see an indention on the side where she has lymphatic injury, no indention on the other side, or in some cases, there may be a deeper indention on the side where there's swelling. That could be lymphedema in the chest, okay? So definitely do not just let that go. If you're seeing one side where the indentation is more profound than the other, you need to let your doctor know. The first 5 years is the greatest risk for getting lymphedema. However, once your lymphatic system is injured, it is injured for life. And so people can get lymphedema at any point after their cancer treatment. There is a lifelong risk. However, there is treatment for lymphedema. Although once you have lymphedema, you're always at risk for swelling, and the swelling may not go away 100%. It can be significantly reduced, and it can be well managed. So early intervention, early treatment is imperative in order to get the best results with your treatment. Factors that increase your risk for getting lymphedema. First of all, the stage of your cancer treatments. The higher staging you are, the more intense your treatment's going to be. The more intense your radiation is going to be, the more lymph nodes they're going to have to remove. And the more intense your treatment is, the more damage to your lymphatic system. Also, the number of lymph nodes dissected, I think that makes sense, right? More lymph nodes removed, more injury to the lymphatic system. Again, the intensity of the radiation, also the location of the radiation. In some cases, your radiation oncologist is going to have to do radiation directly to your armpit, versus in other cases where it's primarily more the breast area or the chest area. So if it's primarily, or if it's honed in on the armpit area with your radiation treatment, there's going to be more damage to your lymph nodes. And then inflammation and infection. The more inflamed you are, or the longer time it takes to heal, or the more infections you have, the harder your lymphatic system has to work. Harder your lymphatic system has to work, the more likely it is to not be able to do the work it needs to do and to have issues with the backup of fluid or lymphedema. How can you reduce your risk for lymphedema? The previous slide, if you notice, are things that you're not really in control of. These are imperative decisions to be made by your cancer care team to help you with survivorship and to help minimize your risk for recurrence. So these are things that you cannot control. However, there are some things that you can control that may help reduce your risk for getting lymphedema. First of all, maintaining a healthy body weight. We're going to talk about that in a little bit more in a moment. But the higher body mass index you have, or the more fat you have, the more your lymphatic system is damaged and the harder it has to work. So maintaining a healthy lifestyle with both diet and exercise is helpful for maintaining a healthy lymphatic system. Regular exercise. Not only will it help with maintaining a healthy body weight, but remember, exercise also helps that pumping action of your lymphatic system, help pumping those muscles, which will help move lymphatic fluid through your body. You want to use the arm and the chest area on that side after you've recovered from surgery normally. You do not want to baby it. You want to, of course, listen to your body, work your way up to your previous mobility level. You don't want to just dive in, but you do not want to baby that arm or not use that arm, because we need movement, we need flexibility, and we need strength in that arm to help promote lymphatic circulation. And then also reduce your risk for infection the best you can. So we spoke a little bit about obesity increases your risk for getting lymphedema, but the literature is pretty profound in stating that people who have a body mass index of 25 to 30 or more have an increased risk of getting lymphedema. So healthy lifestyle. Why this is that multiple reasons here. First of all, fat cells produce a hormone that damages lymphatic vessels and causes leakage of lymphatic fluid out into the tissue spaces. Also, these hormones impair the ability for the lymphatic vessels to contract as well. And then when lymphatic fluid is just sitting in your tissue spaces and not moving through, it can stimulate more fat cell growth. So it's this cycle. Lymphatic fluid is stagnant, more fat cell growth. Lymphatic fluid is more stagnant, more fat cell growth. You want to reduce your risk for infection, so you want to moisturize your skin daily. Any cracks in the skin could introduce bacteria and cause an infection. You want to use sunscreen and insect repellent as appropriate. You want to use gloves when working, cooking, gardening, anything that may create some injury to your hands. You want to keep any cuts or injuries clean, right? So with Neosporin, with any sort of antiseptic cream, and watch for signs of infection. Signs of infection are listed here. If you do have signs of infection, you want to see your medical doctor immediately. You do not want to wait. So if it's a weekend and your medical doctor is not available, you do want to go to an urgent care or a medical doctor that is open to have that infection addressed quickly, as it can spread. How do you find a certified lymphedema therapist? Here is a list of several different schools for certifying lymphedema therapists, where you can search or have directories of certified lymphedema therapists. Not every physical therapist or every occupational therapist is a certified lymphedema therapist. It is an advanced certification. So you need to find someone that has the letters CLT behind their name, certified lymphedema therapist, in order to treat lymphedema. It could be appropriate to see a lymphedema therapist if you don't have lymphedema, but you want to understand your risks specific to your cancer treatment. And so some people will see a certified lymphedema therapist once to get baseline measurements and to understand their risks and evaluate your strength and your mobility and get you on a good stretching program or exercise program to ensure that if something was to come up in the future, you have a therapist on your team, you have those baseline measurements. And so it could be caught quickly and treatment can be started quickly. Thank you so much for your attention today with this presentation. This is my information if you need to reach out to me, and I appreciate your time.